That's a bit of a bit cryptic, isn't it? So FTM is female to male, so gender reassignment surgery. So the top would be the breast, so making a female look like a male, so removing the breast, removing the breast, basically. So essentially, the short answer is no, and the reason it's a no is because it's a specialist area. Gender reassignment surgery, in general terms, is a specialist area, requires an MDT, and it is not something that I do or I specialise in. And my colleague Guy Stern works in the area, and he has connections with MDTs and psychologists, etc. So he is the person I would refer to for that surgery. The actual doing of the surgery is quite similar, so it's kind of similar to sort of breast reduction gynecomastia sort of thing. Female to male, similarly male to female, is kind of similar to breast reconstruction, breast augmentation. So the surgery is kind of similar, but they're all like with anything, there are nuances in it, and you always kind of want to see a specialist really because of those nuances, and you want to see someone who's doing it regularly. And I'm not doing it regularly, I'm not doing it at all. So it's just one of those things that's partitioned into certain surgeons have specialist interest in it, and I don't have that. So Guy used to do it in the NHS when I worked with him and had all the connections there, and so I think has sort of carried on doing it in the private sector, and that's kind of how it tends to work in the private sector. You have a special interest in the NHS, then you keep with that sort of thing in the private sector, keeping within your scope of practice.